I think the most important thing to help a person with dementia is actually diagnose them, because I feel a lot of times what happens is people just come with certain notions. They feel that their kin has dementia, they feel they are forgetting. So I think a diagnostic way of actually having a memory testing along with maybe an imaging and some blood tests which can rule out some reversible causes of dementia. Again, remember there are reversible causes of dementia as well. And trying to make sure that we make them understand to the extent that they can, but make sure that the relative or the kin, sometimes it could be just a paid caregiver who might have no history whatsoever. So you will actually have to hear their history, and then you'll have to actually get the relative also, because sometimes you will be thinking that the person is absolutely normal but the history says otherwise.
So, I think one of the most understated fact is that social interaction is very important for these patients. So, they need to be integrated into the society as much as possible as any other normal human being. So, social interaction plays a major role.
Then very important to focus is on quality of life. Remember, dementia care is about care. It is not about cure. It is about quality of life. It is about independence. It is about making sure that they remain away from the bed and more mobile as compared to bedridden.
Cognitive training is one thing which is also very important. You can help them to solve puzzles. Once they get into it, that will help them to memorize things. And if you started at an early age, the decline will be much slower.
So the most important dictum again will always be get the best possible history. I'm saying best because you might not get the right one, and also look at how they are dressed, how they are actually expressing themselves. Look at the caregiver, whether they are interfering with the history, because a lot of times the caregivers have denial, thinking that they don't have anything, they're just behaving like this. So listen, hear properly, but at the same time make your judgments about diagnosis after a detailed assessment and investigation.
And another important thing which cannot be stressed enough is early diagnosis and treating the reversible causes. So that is one thing which is completely achievable.